I'm Shelly Fuld Nasso, and I'm the CEO of the National Coalition for Cancer Survivorship. We're a patient advocacy group based in the Washington, D.C. area, and we advocate for quality cancer care for everyone touched by cancer. So we do that by educating cancer survivors on how to be self-advocates and really take control of their care and advocate for themselves, but also by working on public policy to try to improve the quality of cancer care. So we have an advocacy network called the Cancer Policy and Advocacy Team, where cancer survivors and caregivers and just people who care about improving cancer care can join. And we have meetings in Washington, D.C. and webinars, and we meet with members of Congress and talk to them about issues around survivorship and quality of cancer care.
A need for your organization or for any kind of advocacy for cancer survivors and or people living with cancer?
So, we think of advocacy in kind of on three levels. One is self-advocacy. So you have to be your own self-advocate to make sure you get the right care that you need. And especially, I think the cancer care system is much better at taking care of people while they're in treatment. But once you make that transition to survivorship, there's a lot less support. There was a report done about 17 years ago called Lost in Transition that talked about how cancer survivors really do feel lost when they complete treatment and they're sort of sent out on their own to live their lives and they don't have the same level of support. So self-advocacy becomes really important because you have to really bring up issues, because we know that cancer doesn't end when treatment ends. So you have the long-term effects of cancer. So you have to be able to advocate for yourself and talk to your doctor about what's going on, ask the questions that they may not think to ask you. They may be focusing on the physical part, but you have a lot of, mental health issues related to your cancer treatment, and that's not always addressed. So sometimes that you have to be a self-advocate. Then there's advocacy for others, and that's what Cancer Awareness Network does, and what NCCS, my organization, does, where it's really just directly helping people. So I think Loretta Herring and her organization has done an incredible job of really going out in the community and helping individuals going through cancer treatment. That's the kind of direct advocacy for individuals. And then there's sort of more looking at the systemic, the cancer care system. Some of the problems that cancer patients face are as a result of our healthcare system. It's very fragmented. It's based on how doctors get paid for certain things, and they don't get paid for other things, and those other things are maybe the things that you need. So we have to work to change how we measure quality in the cancer care system, how we pay for cancer care, because that's going to help improve the care people receive. And that's the kind of public policy advocacy that we do. And part of it is talking to Congress, and so people can talk to their legislators about legislation. But part of it is also working with other parts of the federal government. So the Food and Drug Administration approves cancer medicines. The Centers for Medicare and Medicaid Services pays for Medicare and Medicaid. Medicare is the biggest payer for cancer care. So how they pay for cancer affects how cancer is delivered. So some of what we do is working directly with or bringing the patient perspective to these different federal government organizations that really have a huge impact on how cancer care is delivered. And also working with professional societies of the physicians and nurses and the different people who are part of the cancer care system, and trying to bring to them, here's what patients need. One of the things we do is that we have a State of Cancer Survivorship survey that we do every year, and we ask cancer patients about their experience during cancer treatment and after treatment, and where some of the gaps are. And we use that data to try to help educate people on, what cancer patients are saying about their experience and where the gaps are, where the needs are that are not being fulfilled. So some of the things we find consistently is that, cancer survivors deal with long-term effects of anxiety and fatigue and cognitive issues that are not always being addressed very well. The physical side effects are often much better addressed, but some of those less tangible, harder to address issues they're not being asked about it. They're not getting the support that they need. And that has been pretty consistent every year in our survey. So we try to use that data from cancer survivors to bring that to all of the different people involved in cancer care to try to help them understand where the gaps are and how we can improve them.
Is there a particular gap that is really standing out to you in your organization in terms of what people are in need of right now?
There are so many gaps. So one of the ones that we focus a lot on is cancer care planning. So when getting a plan for your care at the beginning of treatment, and then when you transition to post-treatment. So many cancer survivors don't get that. So they're just told, okay, come back in 3 months or 6 months, go live your life. And they feel that lost in transition. And so we have advocated to try to get, as a standard of practice, to have every cancer survivor get a survivorship care plan that helps them understand what's coming next. They've finished their treatment, but the effects are still there. And what do they need? How can they try to reduce their risk of recurrence with lifestyle? People know that they need to exercise and nutrition, but they don't know what to do. We're not giving them the information they need about that. They know maybe you need these scans at these intervals, but not all of the other ways that they can manage the long-term effects of their cancer care. They don't always know that they can do cancer rehabilitation to address some of the physical effects of the mobility and functional issues that may result from cancer treatment. And they're not always being told about that. So a cancer care plan would really help them understand all the different ways that they can be active in managing their health, and then communicate that among all the different providers, because you may have your primary care physician, you may have cardiotoxicities from your cancer treatment and have a cardiologist, and then you still see your oncologist, but there's not that coordination between those different providers. So that's a big gap that we see. There are many others, but that's one that we've tried to work on. There's also, definitely disparities in access to clinical trials. We don't have enough representation of people of color in clinical trials. The patients in clinical trials don't adequately represent the people who will be using the treatments once they're approved. And that's not acceptable, and it's a challenge to get to have that diversity. And part of it is just that patients are not always asked to participate. That's the biggest factor. For someone participating in clinical trials, they have to be asked if you want to participate, and then be educated in dispelling myths that may remain about what clinical trials do. But I think that the biggest issue is they're just not being asked. So that's another huge gap that I think many in the cancer community are trying to address.
So what can everyday people do to be their own advocates, regardless of whether or not the infrastructure is there?
Well, first of all, I would love to see a healthcare system where you don't have to be a good advocate to still get the quality of care you need. I think that, some people don't feel equipped to be a self-advocate, and I frankly don't think you should have to when you're facing a diagnosis like cancer. You should be able to just get the care you need, but unfortunately that is not the system we have, so you have to. So I think the most important thing is to reach out and find resources that are quality resources. There's a lot of information on the internet. It's not all great. So you need to find quality, respected information about the condition you have and the side effects, so that you can so that you can bring to your physician or your care team informed questions. And you need to really, you may have to bring things up. So they may not always ask you about your anxiety or depression. Or a big one, and I was just reading about this last night, is sexual function is a huge issue for cancer patients after treatment, but they don't want to talk about it. So it's not always addressed. So that's something that may fall to you to ask those questions. So there are resources online to help you learn the skills to become a self-advocate, because it doesn't always come naturally to people. And sometimes it's maybe getting the person, having somebody go with you that can help you listen, that can help you take notes, and that can help you ask the questions you need to ask. Because you may not be, when you hear the words you have cancer, kind of go blank and you don't retain all of the information, and it's hard to do that. So it takes sort of educating yourself, getting somebody to help support you, figuring out the questions to ask, and then keep pushing if you're not getting the answers. Because sometimes, physicians are limited in the amount of time they have, and you just may have to, say, I need more time, I have some concerns I need addressed, and make sure that they're helping you get the answers that you need.